sponsored by PediaTrust. It's a live Q&A session tonight, and tonight we're focusing on pregnancy, delivery, and the care of the newborn in those first few weeks after delivery. And we have a very esteemed panel with us tonight to answer your questions. My name is Dr. Ruben Rucoba. I'm a pediatrician at PediaTrust and the Director of Medical Services there. And I'll be moderating tonight's session. On the forum tonight, answering your questions as I introduce everybody, if you could give a little wave so we can put a name to a face so everybody knows who's who. Our first panelist is Dr. Sharon Flint from Ad Park Pediatric Associates, and they have offices in Addison and Oak Park. Our next forum physician is Dr. Sara Starr from Highland Park Pediatric Associates. Joining us also from PediaTrust. And also on the forum tonight is Chana Goldstein from PediaTrust Lactation Department. She's the head of that department and sees patients at several of our sites in the suburbs. And our special guest tonight is Dr. Cheryl Axelrod, an obstetrician from the Midwest Center for Women's Healthcare, who have offices all over the north and northwest suburbs, though Dr. Axelrod practices out of their Skokie office.
Quiet, please. I'm trying to listen to this.
So if you can, mute your computer or cell phone at home. Thanks. I just want to make a note. This is being recorded, and we will send out an email soon to all of the people who registered for the session tonight with details on how to access that recording. So you don't have to worry about taking notes or, if you miss a phrase or a sentence here or there. You'll be able to see the recording, and we'll send that out soon. And for those of you who didn't register, we'll post the information on our website at pediatrust.com, and I assume the same will be done for the Midwest Center for Women's Healthcare. They'll post it on their website too. So you'll be able to see the recording of the session tonight and all the answers that are given. Over the last few weeks, parents have been sending in questions for us, so we've compiled a list of questions that we want to get to. That seem the most relevant and the most popular questions. But you have the ability to send in a question tonight as well, either through the chat function on the Zoom call or through the Facebook Live feed. So we'll be monitoring those feeds, and we'll try and get to some of those questions. But obviously, we want to keep this limited to the hour time limit. So we'll try and get to some of those questions if we can. But send in your questions, and we'll do the best we can. All right, let's get down to it. I'd like to start off tonight's forum with a question to our guest speaker, Dr. Cheryl Axelrod. And it's a very general question, Dr. Axelrod. We had a lot of questions about what expectant moms in the audience can anticipate during delivery during this COVID pandemic. Specifically, are most hospitals allowing the father in the room or other family members during delivery? Do you have to quarantine before delivery? Do you have to wear a mask during labor? What can you tell us about delivery during this pandemic that might be different than delivering before the pandemic?
So first of all, I really want to reassure everybody that our hospitals are incredibly safe places to have your babies. Significant time and effort has really gone into making sure that moms and their support people, your nurses, your doctors, and other staff are appropriately screened before entering the hospital. When and if somebody is found to be positive, we're really taking the appropriate steps to minimize exposure to other patients and staff. We really do have this down at this point, unfortunately. Delivery is pretty similar to pre-COVID times with just a few caveats. So obviously, all of your hospital staff is going to be masked at all times. And I promise you, we're going to smile a lot with our eyes. We'll ask you and your visitor to be masked within reason, though. Through much of labor, it's not a big deal to put on a mask, especially for your partner when we come into the room. In most places, your doctors and nurses are going to be wearing N95s when you're pushing. So if you need to push without a mask, in my experience, that's been completely fine. As most of you know, visitors are now limited at most facilities to just one labor support person. This is so important, and it's really just to reduce everybody's exposure to COVID. Luckily, we've got technology, with our phones, FaceTime, etc. Friends and family that we really want to share these moments with can still participate. It's just in a slightly different way. I really don't anticipate us reaching any point locally where we would eliminate this labor support visitor, okay, your husband or partner or doula or mother, whoever that's working for you personally. Most of my patients have actually enjoyed this excuse to just limit extended family visitors and soak in this quiet time with their partner and their new baby. Now, I will say most hospitals now are screening all admissions to labor and delivery for COVID. This is helping us to keep our staff and other patients safe by taking appropriate precautions when we find people who are asymptomatic but still positive for COVID. If you're scheduled for a C-section or an induction, you're likely going to be offered screening 2 to 3 days prior to your scheduled time. After your test is done, in that little period of time, we do ask that you quarantine at home prior to delivery. However, for those of you just awaiting spontaneous labor, just take the precautions that you have been throughout this whole time, you know, washing your hands, socially distancing, and just being generally smart about it. In general, please be reassured that the risk of getting COVID in the hospital is much smaller. I've heard a little talk, right, about people saying, well, should I have a home birth because the hospital must be a terrible place? The risk of getting COVID in the hospital is minuscule. And we do know that the risk of home birth, there are lots of risks to that. So please talk with your obstetric providers about your specific concerns. But rest assured that hospitals are really safe places to have your baby.
All right, thank you, Dr. Axelrod. That's very helpful to know. And I should point out here that we had a lot of questions about what delivery might be like, or what the rules might be like, or the restrictions in very specific hospitals, you know, at this hospital, that hospital. And it's a little bit out of the realm of this discussion tonight, but obviously for those of you delivering at certain hospitals, you can always call that hospital. I'm sure they have somebody that can give you that information, or speak to your obstetrician about that. All right, so now that we've dealt with what delivery is like, one of the first things that pediatricians always recommend to new mothers as soon as they deliver is to breastfeed the baby if possible. And so this next question goes to our lactation consultant, Chana Goldstein. Is there anything different about breastfeeding during the pandemic that you can tell our audience tonight? Chana, you're muted.
Okay, I'm unmuted. Okay, thank you for your patience. So with breastfeeding, there is no change with this pandemic. One thing for sure you want to think about: when we were all scrounging around in the beginning for toilet paper, we had heard that there were also people scrounging around for formula. So that is something to keep in the back of your mind. With breastfeeding, you're feeding the baby yourself. You've got the milk right there. If you do test positive, or there is a suspicion that you might test positive for COVID and you don't know yet, then the recommendations have been to use good hand hygiene and wear a mask while you're breastfeeding. But otherwise, there is no change to breastfeeding during this time that we're going through right now.
Ruben, you're muted too, love.
You know, we've been doing this for 3 months and I still can't get used to this. All right. So thank you for that. So I can see on the chat that we have a couple of questions already. And this next question is related to that. I'd like to send this one to Dr. Starr. We've had several questions about what to do when we bring the baby home. Now the baby, you know, assuming mom is negative, baby's negative, everything went fine, got a term healthy baby. What advice do you have, Sara, for new moms, specifically regarding visitors, masking, how to handle household contacts who work outside the home?
Regarding visitors.
So thank you for the introduction, Ruben. First off, I just want to say congratulations. You've got a new baby. You're on your way home. This is a fantastic, wonderful, exciting adventure. So let me tell you that in the first month of life, it's really hard for us to know if a baby is sick or not sick. So we tend to be exceedingly cautious, and we want everyone to limit the baby's exposure to any sort of infectious diseases, things that are through the airborne or any other ways that a baby can get sick. And because of that, we want you to limit your visitors. I tell this to everyone having nothing to do with COVID. I know that everyone wants to come and visit. I'm going to get to specifics about that in just a minute. You want to make sure that anyone who's around the baby is fully vaccinated, that they've had their flu shot, especially as we come into the fall here, and the flu season is going to be confusing with COVID at the same time. So make sure everybody's got their flu shot. Make sure that all parents and any other family members, anyone who lives in the house, and any visitors also have to be vaccinated for tetanus whooping cough vaccine. Whooping cough is an illness that can be spread to babies and can be very dangerous. In adults, it's not so dangerous, but they may not even know that they have it. You need to ask anyone who's coming into your house, again, regardless of COVID, have they been sick recently? Like in the last 2 weeks, have they had a fever? Have they had a cough? Have they had a runny nose? I want you to be really specific when you ask these questions to your visitors and guests, because they may downplay things, and you have to really be careful and make sure that they're being honest with you. You want to also ask them now, because of the pandemic, if they've had any exposure to anyone who's known to have COVID, or a person who's suspected to have COVID. And also if they've been in any large gatherings, like these recent protests and things like that that have been going on across the country. When someone comes into your house, you need to ask them to wash their hands carefully. Soap and water, good scrubbing, 20 seconds at least, the minute they walk in the door. And then if they're going to be touching the baby, they have to wash their hands again, because they may have touched something else in between, especially their face. So you need to be a little careful. You need to assert your authority. You're the parent. You're the one in charge of this baby's health. And I often tell my patients, please, if someone really kicks back at you and pushes back and says, oh, I don't need to do that, you say, yes, you do. My pediatrician said you need to do this. So, you know, you're the ones in charge. You make those decisions. So now I just want to talk about a few things that might be different during this pandemic. We always talk about limiting visitors. Now you really need to limit visitors. I suggest perhaps, if you can, only having the grandparents of the baby come visit. Stagger them so that not everybody's there at the same time. I would recommend, and I strongly recommend, that the parents, meaning you, quarantine yourself for 14 days after you come home from the hospital, as well as the grandparents or whatever visitors you're inviting into your house. They should also be quarantining for 14 days. And let me explain why. It's not the baby's health that we're that worried about. Babies don't usually get COVID-19. And if they do, it's really mild. The ones that we're worried about are the parents coming home from the hospital, because as Dr. Axelrod said, it's very minor. The risks of being in the hospital are very small. Everybody's masked, everybody's gowned, everybody's, being really careful and cautious about washing their hands. But there's still a possibility. So I want to make sure that you, as a parent, and whoever your birthing partner is going to be safe and clear of any illness before you invite anyone else into your house. The people who are grandparents may be higher risk because of underlying health issues or age or both. So you want to make sure that they're safe as well. So asking them to quarantine before they come into your house will prevent anyone in your home getting sick. When anyone comes to visit, they should be wearing a mask. They don't necessarily need to wear gloves if they're doing really good hand washing. Let's talk about travel issues. So if you're having visitors come from out of town, you need to discuss with them how are they going to get to you. If they're driving in from out of town, if they can come without having to stay in any hotel and not stopping at restaurants and things like that, that would be ideal. You just want to minimize the risk as much as you can. If someone needs to travel by airplane, that's a bit riskier. So if they've been quarantining for 14 days and then they have to go through an airport, that changes the risks there. So we are recommending still that people who are higher risk groups not travel by airplane. I talk about keeping a safe pod, or some people call it the circle, their COVID circle. Once you invite someone into your home, keep that group the same. Don't keep alternating visitors. Expand your pod, make sure everyone's safe, everyone's following the same rules, and maybe you can invite them in to stay with you in your home so that you're all quarantining together and keeping outside germs outside. If you have someone who wants to visit you who's not on board and they don't want to do this, then you need to ask them perhaps to just wait and come back later, another time when COVID's not such a big issue and everybody can be calmer and safer. In terms of other people who might want to visit, neighbors, friends, stuff like that, again, I would limit it. You can share pictures of the baby on Facebook or Zoom meetings, things like that. And if they ask in some way that they can help, have them deliver food to your doorstep, bring, groceries, supplies, diapers. You need a lot of this, and it'll be really helpful to have some people help you that way. Ruben, you're muted.
Of course I was. So thank you, Sarah, for that excellent advice. I appreciate that. All right. So this next question, I'm not jumping the gun here, but many of you who are still expecting or have just delivered may be thinking about leaving the house to go to work outside the home, or you have other issues where you're going to need some daycare for your child. And we had a lot of questions about daycare, specifically what questions should you be asking? What things should you be looking for when you're choosing a daycare setting and a daycare provider? So for those answers, I'd like to ask Sharon Flint to weigh in. Sharon?
Yes, thank you, Ruben. And I'm so glad all of you could join us this evening. I wanted to talk about this big decision that you have to make sometimes about daycare. It's a little more problematic with the current pandemic situation that we're in right now. So things to consider are need. Do you need someplace where you can drop off a baby early because you work an early shift? Do you need someplace where you can pick up a little later because you tend to work later in the day? Convenience. Is it easier for you if you have a childcare provider closer to your home, or are you more comfortable having a provider closer to your place of employment? And expense. Childcare can get quite expensive. The other thing to consider is what kind of situation do you want? Do you want a nanny that comes into your house and only cares for your child? Do you perhaps want a small group daycare setting, home daycare in your neighborhood, or would you prefer to have a larger group daycare facility? One of the other things that's important to look at is what is going on with COVID in your community. Do you have very few cases, or is there a little uptick in cases? Thank goodness overall in the state of Illinois, we have seen a steady decline for the last several weeks. One of the other things to think about, as Dr. Starr said, is kind of expanding your COVID circle when you think about daycare. So if you have a nanny coming into your home, you can kind of control and see what's going on during the day when they're with you. But when they leave in the evening, are they making good choices? Are they social distancing? Are they wearing masks? Are they practicing good hand hygiene? If you choose to go to a group daycare setting, there are certainly some questions that are very appropriate to ask. Number one, are they screening children as they arrive at daycare for fever or any signs of illness? By the same token, are they screening their employees when they come to work to make sure they don't have a fever or any illness? And are they encouraging their employees to stay home if they're sick? Do they have a good kind of staggered drop-off and pickup system where they meet you outside to gather up the children so they don't have lots of adults and children together inside the facility? Are they kind of cohorting the children, meaning they have them in small groups with the same child care provider on a daily basis? Are they practicing good hand hygiene? Are they disinfecting toys and high-touch surfaces on a regular basis? And probably one of the most important things is, do they have a protocol in place should one of the children or one of their staff members get sick during the day while in the facility? The CDC, the Center for Disease Control, has some great guidelines and very specific guidelines for childcare in the midst of this pandemic. But I don't want any of you to feel guilty about sending your child to daycare. Daycare is really what keeps families running. And if you are a parent working a demanding full-time job at home and trying to care for a baby at the same time, it's near impossible. So please rest assured that there are lots of good, safe options out there. Thank you.
Thank you, Dr. Flint. You know, and again, for those who may have joined late, you know, Sharon went through a lot of questions to ask and good information. If you are struggling to take notes or worried that you missed a question or two, don't worry. The recording will be, the session will be recorded, and we'll get information to you soon about how to access that recording. So thanks again for all of that information, Dr. Flint. Let's go back to delivering in the hospital for just a moment. After you deliver, we talked about breastfeeding, and a couple of people have asked a question about, is the virus transmitted through breast milk? So Chana, can you address that question?
Sure. So all the information that has been looked at by the World Health Organization, the CDC, the American Academy of Pediatrics, every organization that has been looking at this has come out and said that there is no evidence that COVID-19 is being passed through breast milk. So there is nothing to fear in terms of passing these germs through the breast milk. If anything, breast milk is full of antibodies and will help keep your baby as healthy as possible.
Right. Okay, so staying in the delivery room, I want to broach one question. This was sent in actually earlier, and I see that there's a chat question that is almost the exact same question, and it is this. I'll quote exactly the question we got earlier in the week. One mom wrote, "I don't want to be separated from my infant in the hospital, so I don't want to be tested for COVID," unquote. So she wants to know how she can arrange for that. And Dr. Axelrod, what would you say to that mom if she were in your office and your patient?
Sure, it's a great question. I mean, none of us, no one, right, gets pregnant and hopes to be separated from their baby for any period of time, right? We've been looking forward to this blissful reunion, if you will, face-to-face for 9 months. And Dr. Flint's going to touch on some of this in a bit. But shortly, you have two options if you test positive around the time of labor, okay? And I like to call these minimal risk and reduced risk, okay? So minimal risk, where your baby is actually separated from you in another room or in the nursery or whatever and kept separate. Reduced risk is where your baby is in the room with you, but 6 feet away in a special crib. And every time you hold your baby and breastfeed and things like that, you kind of wipe everything off antiseptically, wear a mask. We know, like our lactation consultant just talked about, COVID is not transmitted through breast milk. It's really respiratory transmission, okay? There's some surface transmission, but primarily respiratory. So if you wear a mask, you can primarily protect your baby that way, okay? So this is your choice. And different hospitals kind of have different ways of going about it, but it's ultimately your choice. And they'll have people come and talk to you, the pluses and minuses. But if you would prefer the reduced risk where the baby is in the room with you, again, that's your choice. No hospital is going to force you to do a test. I would check with your OB or your midwife about the policies at your specific hospital, because in theory, if you decline the test, the hospital could decide to assume you're positive and treat you as such, okay? I haven't heard of anybody doing that, but there's so many hospitals in this area, we can't keep track. Finding asymptomatic positives really allows us to protect patients and staff to the best of our ability. It allows us to appropriately counsel those who test positive but don't know it, so that you can protect the rest of your family and your whole community. And it's really the best practices right now. Everywhere from, you know, our little societies all the way up to our governor is recommending testing everyone admitted to labor and delivery.
Thank you very much. All right. Speaking of that, and you mentioned Dr. Flint, Sharon, what happens to the baby if the mother does test positive for COVID at delivery? And again, there's options. They don't necessarily need to be separated, but what will be done to the baby? Can you fill us in on your experience?
Sure, Ruben. So as Dr. Axelrod said, there are a couple options, kind of reducing your risk or minimizing your risk as much as possible. Just to warn you, if a mother is COVID positive, when she's in the delivery room, all the staff members in there will be in full protective equipment, meaning a mask, a face shield, gown, and gloves. After the baby is born, if you decide after talking to your OB beforehand, and sometimes even looping in your pediatrician, that you want to do everything you can to minimize the risk, they will take the baby, put the baby in an isolette, and if you agree to it, separate you from the baby and take the baby to an isolation room in the nursery. You know, no matter what you do, it's important that the babies get bathed as soon as possible, just to eliminate any risk of virus on their body. If you decide to be separated from your baby, the baby's in the nursery room, they get COVID tested, ideally at 24 hours, and if the baby is still there, at 48 hours. But during that time, the mom would have no contact with the baby. The other option, as Dr. Axelrod said, because it's really hard to be separated from your baby at delivery, the baby could room in with the mother, again, just reducing the risk. In that case, as was alluded to, you know, mom should stay 6 feet apart as much as possible. Mom should wear a mask. Mom should practice good hand hygiene at all times. Now, one of the other things that comes up is if you decide you absolutely want to minimize the risk, it's been 48 hours, the baby's had 2 COVID tests, they have been negative, it comes time for the baby to be discharged home. Some moms have made the decision that they'd rather their baby go home with a healthy caregiver until the mom can be cleared of her COVID, clinically, depending on how she's doing. I know, again, this is a very tough decision to make. Again, a lot of times these babies can go home with the parents, practicing, you know, good technique at home, separating as much as you can. I will warn you, if a mom is COVID positive, even if the baby has tested negative twice, it's very important that those babies be watched closely for the first 2 weeks of life to make sure there's no evidence of any infection. So it'll mean some frequent contact with your pediatrician. Thanks.
Thank you. Thank you for that, Sharon. You know, just as a follow-up, I want to clarify a point. One of our audience members just asked a question. If there's very little risk, or if COVID is very minimal in babies, as Dr. Starr mentioned, and that is the truth, then why even take these precautions? And I would say, I'll just answer this question. I would say that, you know, this is evolving. The first month that we were dealing with this pandemic, you know, it was widely thought, oh, babies can't get this. Nobody under 1 has ever died from it. It's a very mild illness. And then what do you know? There was a couple of cases of infants who did contract the illness, got very sick, and actually 1 or 2 of them succumbed. Now that's across the globe, and you know, millions have gotten this virus. So it's an extremely rare instance, but we just want to do everything we can to protect this baby that, you know, you've carried for 9 months, and you've done everything you can to protect it. And we're all doing the same thing. You know, we don't want a month from now to find out, oh my goodness, you know, babies can get it. You know, we haven't been as careful and something really bad happens. So that's why it's not 0 risk. It's very, very small risk, but there is a risk. So we do want to do everything we can to protect the health, obviously, of your brand new baby. So this next question is going to go back to Dr. Axelrod. We've had a couple of questions related to is it even safe to consider conceiving at this time during the pandemic? And B, what if mom gets COVID, not at the time of delivery, but during the pregnancy? Is there a risk to the fetus? Cheryl, what can you tell us?
Thank you. And I think there's, like you said, this virus has been around for 5 months. Okay. Well, now it's June, so 6. I started this speech in May. So we're learning new things every day. And there are studies out there where we're collecting data on women who are pregnant, who have delivered, and who have had COVID. And every day, like I said, we get more data. But what we think now, out of these 6 months of experiences, is that a pregnant woman has the same complication risk of COVID: hospitalizations, ICU, ventilation, death, all those awful things, as a similarly matched woman to her age and general health. So it doesn't increase your risk of COVID badness, if you will. Being pregnant doesn't. So how does it affect the baby? Okay, and so far it seems like there's not an increased risk to the infant. We don't seem to have data that suggests any long-term data, but we've been able to look at placental specimens, and we see evidence of the virus working in the placenta, but the babies test negative. Okay. We do know that when you are infected with the coronavirus, you have COVID, your risk of blood clots is slightly higher than if you're not infected with coronavirus. And the risk of blood clots in pregnancy is generally raised as well. So we may recommend some blood center shots for 2 to 6 weeks if you do contract COVID while you're pregnant or in the postpartum period. The moms that we've seen at my hospital have all either recovered at home entirely, which is lovely. I have a patient who that has happened to, or recovered, were hospitalized, went home, and then have come back to deliver. So far, luckily, no issues that we know of long-term that increase your risk in pregnancy or for the baby. Now, should you try to conceive, that's always a personal decision, right? Building your family is always a very personal choice. I don't think, to the best of our knowledge, there are any increased risks of COVID on your pregnancy or your infant, as we know right now. Obviously, we can't put a pause button right on our biological clocks or on kind of our social situation, family size, whatever. If you wait another year to get pregnant, what are the implications for your health and your family's financial situation and how your kids will relate to each other in their ages? I think these are just all things to consider. But I do think, and I've been telling my patients, it is a safe time to get pregnant.
Thank you, Dr. Axelrod. Okay. This next question is going to go to Dr. Starr. We're opening up the state, which is good news. As Dr. Flint mentioned, cases are going down, and at this point, school is planning to restart in the fall. We're not quite sure what's going to happen after that, but many of you may have older children or toddlers that are going to preschool or school-age children, and you may be worried about a baby that's 2-3 months old at that point, and exposing them to the germs that the school-age kids are bringing home. Dr. Starr, what can you tell us about how to keep a baby safe in these circumstances? And specifically, maybe address a little more. We've been getting a lot of questions on the chat about quarantining again. You mentioned earlier about grandparents quarantining and this and that. What if they go to work? What if they work outside the home? What if they go to the grocery store? Can you help us deal with how to keep a newborn healthy with kids that are older siblings that are going to school, grandparents who may be continuing to visit visit other sites outside of that home? What advice do you have?
Sure, those are great questions. So let me talk about the siblings in the home first. When there's older siblings and you've got a new baby in the house, you just have to kind of know that next baby is going to get sick more often than your first baby. Because if you have a toddler or school-age child, they're going to bring home germs with them, no matter how hard they try not to. It's, you know, the schools, we're talking about the schools reopening in the fall, and they're going to try to limit class size. They're going to have to make, you know, try to get kids to wear masks. It's just not a perfect world. There's going to be illness. So as I said before, I'm really not as worried about the new babies getting COVID, because as we've all heard, it's really not the babies, the new babies who are getting really sick with COVID. It's more the adults and people who are high risk due to chronic medical problems. So more important from my perspective is let's keep other types of germs out of your house as much as possible, not just the COVID stuff. Your baby needs to be vaccinated on time. That means you need to bring your infant into your pediatrician's office to get their shots. I'm more worried about things like whooping cough and measles and influenza, the things that are always here that get spread very easily. From person to person, especially from younger children, school-age children who don't wash their hands carefully, and they're always, you know, wiping their nose on their sleeve and hands and stuff like that. So to me, that's a bigger issue. I'm not as worried about children, older siblings coming home from school. Still, I would ask them to wash their hands very carefully. That means, you know, the 20 seconds, and carefully and multiple times throughout the day, especially if they're going to be wanting to hang out with a newborn. You may find, of course, that the older siblings aren't that interested in a newborn anyway at first, because new babies don't do anything exciting or interesting to them. All right, now I'm going to go back to the other question, Ruben. I think you said about older parents and grandparents who might be working outside of the home, and if they're safe to come and visit. So again, the biggest concern is for those people themselves, for their health and safety. If they're working out of the house and they're going to the grocery store or whatever, this is their risk that they're dealing with. And my other concern is that if they come and visit your home, are they going to get you sick? This is a decision you have to make. You know, if you want to be super, super perfectly careful as best as you can, you might say, I don't want you coming to visit if you're going to be out and about in the world. Now, if you know that those visitors are going to be exceedingly careful, wearing a mask, maybe wearing gloves, social distancing, then maybe you'll say, okay, I'm willing to take that risk, and that's fine. But this pandemic is real. It's not a hoax. It's going to be around for a while. So yes, we do have to get back to our lives. And that means going to grocery stores and working, but it doesn't necessarily mean that we want to risk everything. So everything is a balance, and you'll have to see what works best for you. Hope that answers everything, Ruben.
I think so. There's obviously going to be, you know, very specific questions that some of you may have about in this situation or that situation. And I do think that that's when it's important to, you know, talk with your pediatric provider and say, look, I'm worried. My mother or mother-in-law works outside the home. She won't mask. She doesn't want to quarantine. And, you know, you need to have that discussion with your pediatrician to figure out the best way to handle that. But, you know, Sara mentioned earlier about the idea of a pod, keeping people, you know, those who've been coming to your home for the first few weeks and not, you know, expanding it too large. So, you know, another simple maneuver, as was mentioned, is to maybe take everybody's temperature before they come in to see the baby. That's certainly what we do in our offices. It's not foolproof, but it is something, might give you some reassurance. That's just you know, another option. So I would like to send this next question to Dr. Flint. It's very quick. Somebody sent in a question because Sara mentioned something about getting vaccines against other diseases. We know that the whooping cough, or Tdap, vaccine is recommended for all those who are coming into contact with a new baby after birth. The whooping cough immunity does wane. And so older people, even if they've had several shots, might not be immune to it. And whooping cough, not so bad when you're 40 or 50, but can be devastating and even fatal if you catch it, in the first few weeks of life. Most babies can't get their whooping cough vaccine until they're at least 6 or 8 weeks old. So those first 2 months are critical. And the question came up, Sharon, if grandparents or anybody who's going to be around the baby got the Tdap vaccine, let's say 7 years ago with another child, do they need another one? What can you tell us about that?
Thanks, Ruben. They should still be protected. We know usually it's adults who are reservoirs for pertussis or whooping cough. So if they've had a Tdap when they were older, prior to a child being born, a grandchild being born, they should be fine, although no vaccine is foolproof. So, certainly if they have a persistent lingering whoopy cough, I would be concerned, but otherwise they should be fine.
Thank you. And just to answer another question that came up, somebody asked, can you get a flu shot during pregnancy? And the answer, as we all know, is absolutely. You've always been able to do that. It's always a good idea. Obviously, this is not flu season. If you get pregnant now, you're not going to get a flu shot now. But come September, October, and certainly after that, if you're pregnant during those months, it's always a good idea to get that. Okay. Chana, the next question is for you. Are there remote sources of education for breastfeeding moms, either those that have done it before or those who are first-time breastfeeders? What can you tell us?
Okay, so rather than having classes in person, many hospitals are offering classes virtually online. Lactation consultants, some of them in private practice, are offering virtual classes as well. We will be sending out a link to some of these classes that you can look into before you have the baby. I definitely suggest that you choose carefully, because in this age of cyber education, you want to be making very careful choices about where you're getting your education. So you find on the internet they may not be reliable. So you can easily ask in the hospital where you plan to deliver. Many of the hospitals are offering classes, and many of the lactation consultants around the suburbs of Chicago are also offering online classes. So that would be highly recommended. We also will include some links to some videos that you can watch. I mean, obviously classes are more beneficial because you get more individualized attention and you can ask your own questions. But the videos that we're going to be sending out, these links for these videos, are highly recommended to educate yourself about the importance of breastfeeding and the importance of the first few hours of breastfeeding after the baby is born.
Thank you. Very good to know. Okay. The next question is going to go back to Dr. Flint. And Sharon, the question we got, several variations of this question on the live feeds tonight, and that is either in the hospital soon after you've delivered, I'm guessing, and maybe even once you, I think this is in the hospital. If your support person has to leave for a little bit, could you have somebody else come visit you? And I guess that's, I'll put that to both Dr. Axelrod first to address during delivery, before the baby comes, and then to Dr. Flint for when the baby has already been born and dad needs to leave. Can somebody else come and stay with mom? So what's been the policy in the hospitals regarding a couple different people coming in?
Okay, I can start with that, Ruben. Thank you.
Okay.
I know at the hospital that I'm on staff at, they've really gotten quite strict with this. So there is one support person that's able to come in for the labor, the delivery, and until the mother goes home. If it's, the father or a partner, the baby's father, they are able to go home and then come back, but they've really tried to limit it to the same person. Again, they're screening everybody who comes in and out of the hospital. Again, they're just trying to lessen the risk to the staff, to other patients on the floor. So right now at our hospital, you cannot switch people out.
And that's the same at mine. I think, you know, you really should ask your obstetrician. You can call the unit. This is a fluid situation. And I think we're constantly learning and adjusting things. And we will continue to do so as our numbers change, as the numbers in different pockets change, and just as we learn more. But my experience has been the same. I think we started out allowing people to switch out, but it's a parade of people doesn't reduce our risk, sadly. We've just one person who, at least at my hospital now, who can leave and go home and then come back, but it's that same person, not an additional one right now. But check with your own hospital and provider.
Thank you, both of you. All right, Sara, I'm gonna send a question to you at this point. I think you can handle this one. We had a question about choosing a pediatrician, and specifically, you know, how does one get a pediatrician during this time? At least one mom who's not due until October called to set up an interview and was basically told they're not taking interviews for new patients due to COVID. And so her question was, at what point do I really need to have the pediatrician in place? And when might they start to hold interviews again? And what can you tell us about ways that I know at PediaTrust, we've been dealing with this situation? What can you tell us?
Sure, happy to answer that. The meet and greet visits, which is where parents who are expecting or if they're planning to adopt a baby, where they come and meet us and decide, you know, ask us questions and basically interviewing us to see if they want us to be their pediatrician. I can understand that some practices might not want extra people in the office. We're not trying to limit people in our office who come in, just again to minimize risks. Only one parent gets to come with a child for their well visits and things like that. But you still want to meet your pediatrician. So this might be a great time to offer a telemedicine visit where a virtual visit would be great, or you can ask your questions to your prospective pediatrician and learn what you need to know about, you know, would you click with them? Are they qualified? What's their view on certain issues that you're concerned to you? And you obviously want to ask to make sure, how does their practice work? Do they have extended hours? Do they have after hours care? Do they have a lactation nurse or a dietitian? These are all things that we have in our group in PediaTrust. And, you know, they're really helpful for parents, especially new parents who are trying to figure out, you know, what they can do best for their children. But, you know, ask the people that you want to speak to and see if they'll do a virtual visit with them, with you. And as I said, I think that would be a perfect way to handle it, is to do a virtual meeting. And, you know, there may be some practices that are still inviting people to come in and do those kinds of visits. It may be after the usual office hours. Just call and ask and find out.
Thank you. That's great advice. Yeah, almost all of our PediaTrust offices are doing virtual meet and greets now. So it's a way to get around the whole pandemic and still talk face to face with your pediatrician if he can remember to unmute himself. So some of us have a little more trouble with that than others. Sharon, I'm going to send another question to you, and that is, we've been talking about an acute infection of COVID in both the moms and the babies, but there was a lot of media attention a few weeks ago, and there was a question tonight on the chat about this MIS-C, which is multi-system inflammatory syndrome in children that's been related somehow to COVID. Is that something that parents of infants need to worry about? And what do you tell your parents when they ask about that?
Sure. So this is a very rare disorder. You know, it seems that there were a lot of cases out east. Here in the Chicagoland area, we have not seen so many cases, So it appears that this is something that happens maybe 3 to 4 weeks after a child has had a COVID infection. And sometimes parents don't even know that they had COVID. The only way they may pick that up is by testing the child for antibodies. So these children present very, very sick. They come in with fevers, they have very severe abdominal pain, vomiting, diarrhea, they can have very bloodshot eyes, a rash, they're very, very achy. These are not just a child who has a little tummy ache, throws up once, then is otherwise fine. These kids really look sick to the point when you see them, you know they need to be in a pediatric intensive care unit immediately. And again, we think this is related to COVID. It's kind of a post-inflammatory response. You know, usually these children end up in the ICU. It's supportive care that they get. Most of these children do great and recover completely. So again, it's very rare to see. It's not something that parents should be overly concerned about because it is so rare. And I haven't seen any yet, thank goodness.
Yeah, I will reiterate, there's been very, very few cases in the Chicago area, period. And when you compare this to similar syndromes like Kawasaki's disease, the kids who get this syndrome, MIS-C, they all seem to be older, school-age children, young teens in that age group, as opposed to infants and toddlers. So not that, again, it's impossible, but it seems very, very unlikely to strike a very young child, an infant or toddler. These are older kids that are getting this very, very rare illness. So I just want to reiterate that. All right. Chana, we have a question, and maybe you can answer this. Do breastfeeding moms in the hospital still get visited by a lactation consultant in the hospital? And if not, then are there ways for them to connect with a lactation consultant by, you know, a virtual visit, telemedicine, or what have you?
Sure. Okay, good question. Almost every hospital that I'm aware of is offering a lactation consultant, especially if there are some issues going on with the baby and the mom. If mom's having pain with breastfeeding, if mom's having trouble getting the baby to latch, all the hospitals have a lactation consultant on staff. It may be difficult over a holiday weekend, or it may be difficult if you deliver late at night. But during your stay, you should be able to have access to a lactation consultant while you're in the hospital. You can always call and set up an appointment to have a visit with one of our lactation consultants or another lactation consultant after you leave the hospital. Here at PediaTrust, we have 3 lactation consultants that see patients in the office. We can see patients virtually by video, but we try to save those visits for a mom who is COVID positive and cannot come into the office. There are many benefits to seeing a lactation consultant in person. So we definitely recommend that if you're healthy and the baby is well, that you come in and we see you in person. There's a lot we can do with hands-on care to help with situations like a shallow latch or sore nipples, poor milk transfer, slow weight gain, things like that. We're much, much better able to help moms and babies if we can do it in person. The other thing is, it's important to realize that one of the biggest issues that moms face is that they have this preconceived notion that they're not going to be able to make enough milk for their baby. And when moms feel that way, it can really have a very negative impact on their ability to breastfeed, because a lot of it is about confidence. And when you come in to meet with a lactation consultant for a visit, one of the best things we can do is weigh the baby before you feed the baby and again after you feed the baby. And this gives the parents tremendous amount of reassurance and confidence when they see how much how much milk the baby is transferring. And then we use that information to help you set up realistic goals and a care plan for the next few weeks at home. So we can do it virtually, but I definitely recommend doing it in person if you can.
Thank you, Chana, for that. I appreciate it. And I'm just going to put in a plug here to let you know, those of you who are expecting or have delivered, haven't visited our offices in Pediatrust, I just want to let you know what we're doing to keep our offices as safe as possible for anybody who comes in. Because of course, as a new mom, you may be thinking, I don't want my baby exposed to sick kids. And at our offices, everybody is always masked. We're taking temperatures on every person who comes through the office every single day. Full protective gear is being worn for most visits that warrant it. And we've separated our offices either by time, afternoon versus morning, or by location. This office is sick only, this office is well only. Sometimes we have separate entrances for sick and well. We're cleaning the rooms. We're doing everything we can to try and keep our patients, our staff, our parents as healthy as possible. So we've had very, very few COVID positive patients. Most of those are either being seen through telemedicine visits, are being seen outside in the car so that they don't come into the office, or are being routed to an emergency room if they are really, really ill. So our offices are actually, pretty safe. I just wanted to mention that. But we've had a couple of questions tonight, and I think this is going to be our last question. This is going to go to Dr. Starr. Sara, what can you tell us about the symptoms that an infant might display if the infant had an acute COVID infection, not this MIS-C that we talked about earlier with Sharon, but an active COVID infection picked up, from the mom, from whomever, in those first few months of life? What symptoms would an infant display?
Sure, that is a great question. And I wish we had a perfect answer to it. This pandemic, as has been mentioned already this evening, is really new. And we're just learning about how this virus affects people. There's been a lot in the news, of course, of how adults, and especially older adults, what their symptoms are. But with children and infants, it's really new. We're just trying to figure this out. They're different, though. We know that children, younger children, they don't seem to have a coughing illness with this COVID virus. We're not sure why that is, but it seems that's why children don't spread it to other children and to other people, is because they're not spewing the germs out from coughing. They seem to have a lower load of virus in their nose and their nasal passageways. So this is why we don't think that children are the main vectors, the main way that this virus is spread. That being said, what we've been starting to see with children who have COVID virus in their system is more stomach issues like diarrhea or vomiting. And again, it's so hard to know because a child could have those symptoms and be perfectly fine, have nothing wrong with them, or they could have, an upset stomach or whatever. So, as I said, it's really difficult to know with young babies. I just tell people, as a parent, you're probably the best guide. You're the one who knows your child the best. If you think something's wrong, then get on the phone and ask your pediatrician. That's what we're here for. And, use us. So if you're not sure, we want to hear from you.
Thanks, Sara. I appreciate that. I just want to end on this note. PediaTrust is a large organization. We cover over 70,000 patient lives. And I must say, as one of the members of the COVID response team, I've been dealing with this epidemic for the last several months. And honestly, I can tell you that of those 70,000 patients, we have had very, very, very few cases. There are medical reasons, physiological reasons why kids don't get this disease very much, and why they don't, when they do get it, it's not as severe. I'm not going to go into all those medical reasons, but there are legitimate medical reasons. It's not a mystery. So unlike a lot of other illnesses, kids are actually somewhat protected from this. So I'm going to reiterate what Dr. Starr and Dr. Flint mentioned earlier. You know, the ones we worry about are not necessarily the kids, it's the grandparents, it's your parents, your in-laws. And those are the ones that we tend to worry about, those people who have medical issues, underlying chronic conditions, it might be immunocompromised or other things, and are older. But the kids, the one silver lining in this pandemic is that kids seem to be weathering it pretty well. And for us, that's great news. So all of you who have delivered, rest assured, your kids are probably going to be just fine. Those of you who are pregnant, your babies are probably going to be just fine. So that is the good news. And I'm not making that up. That's been borne out over the last several months and across the globe, not just in the United States. Well, we've reached our limit. We're actually a few minutes over. Again, I want to thank all of our panelists tonight. This has been very productive, and I hope most of your questions were answered. We will be sending out details on how to access the recording, along with some of the links to some of those lactation resources that are online. So look for that. And thanks everybody for coming, and good luck.